if I'm an insurance company and I say, hey, listen, anesthesiologist, hey, this procedure should only take 2 hours. If it takes any longer than 2 hours, we're not paying you. What does that do to the anesthesiologist? 30-something minute induction. I'm not doing that. I'm just going to slam the ketamine. Maybe it's his head, maybe it doesn't, but I got to go. I got to go. The insurance company said only 2 hours. Only 2 hours. They don't consider this. Afterward, patient snowed. He's on 5 different medications. I had to give him all this ketamine. I had to add this because now the ketamine, that's 6, plus the propofol I'm giving, plus the fentanyl I'm giving, plus all these medications. Oh, you know what? He's snowed. Hey, my time's over at 2 hours. I got to go. And I leave. No. Instead, I make sure that patient wakes up, is breathing independently, spontaneously, can protect their own airway, can follow instructions, and can get themselves in the car without hurting someone. All these things to make sure the patient is safe. Does it take longer than a normal case? Yes. Am I milking the clock, or am I treating the patient as they would want to be treated, as you'd want your loved one to be treated? That's what's happening. But when you set arbitrary time limits, who gets the shaft? The provider and the patient who's not being treated according to their specific condition. You have to treat the patient, not the profile, the patient. That kid had a great outcome, guys. He got up, listened to my commands, got him in the wheelchair, got him in the car, he got himself in the car, and he went home. Parents were happy as pie. Mom was squeezing me. Oh, thank you so much. We thought we were blah, blah. It was wonderful. It was a beautiful day. But think about things, guys. Physicians are not greedy. Physicians work very hard, sacrifice a lot of years, time, learning all this stuff. Do you guys know how, like, this is going to be weird to say. Can I say this to you guys? Is this okay? Is this a safe space? If this is a safe space, like this video right now. Let me know you guys still with me. We're at exactly an hour. Can I say this in a really safe space? I say this to my wife all the time. And she's like, yeah, you're right. I've seen you. She's like, I've seen you do anesthesia. I know what's up. I said, man, I have learned a lot. I am very, very expert. She's like, yeah, you're right. I said, yeah, I am. I just sometimes I marvel at how hard I've pushed myself to learn so much. And that's why I'm so proud of it, because I'm like, my brain isn't the best brain. I became an elite studier because I committed myself to learning how to study and how to learn things fast and how to retain things and whatever. It takes so much effort and strain and sacrifice to become a highly experienced physician. It's really sad to me when we belittle PhDs, when we belittle MDs, and we devalue education. And we act like, oh, just because you educated don't mean you know stuff. Actually, that's kind of like the definition of education. Like, if I'm educated, if I've trained in medicine, I kind of know my medicine. I'm not, right? If I'm willing to give 4 years of college, if I'm willing to give 4 years of med school, 4 years plus of residency, if I'm willing to do all these things and rack up hundreds of thousands of dollars in debt, I think I've earned the right to be able to use my knowledge to help my patients the best I can. I'm proud of the fact that I'm an expert, and I feel like our healthcare system and the healthcare economics devalues expertise. It devalues critical thinking. It devalues looking at the nuances of a patient and designing a specific plan to them. And this is why you see so many people rebelling against healthcare right now, right? And they want their concierge medicine. They want their, right? The next wave of medicine is genetic-based medicine. We're talking about specifically treating the patient. So why, if we're talking about the future, the frontier of pharmaceuticals is in tailored medications, why wouldn't the future of clinical care, of physician care, be patient-centric care? Why do we separate the two? Why do we devalue the fact that I'm trying to do nuanced, high-level, specific care? I believe in the art of anesthesia. And yes, not just waking a patient up. I want them to have the best day of their gosh darn life. I want them to want to have surgery every day. That's how good I want their day to go. I want them to feel safe and comfortable. I want them to feel pain-free. I want them to feel like, man, because you guys know, or you guys might not know, but if I told you, hey, you have to have surgery tomorrow, oh, you'd be scared. Scariest day of your life. I never had surgery before. And it truly is. That's why I love anesthesia, because it's the scariest day of their life. And I get to go in there and I get to make them feel like it's going to be okay. Here's my plan. And I articulate it to them. It's the same thrill I get from working with students. I love it. You guys are scared. Am I enough? I might be, it's not good enough. The course is too hard. And I say, no, I got you. Here's the plan. And when I see you guys' faces light up when you have a good plan, when I see you guys' face light up when you get the acceptance, when you guys succeed and get the white, like, it's a beautiful thing, because I'm like, I did that. I created certainty. I created surety. I created confidence. I created an opportunity for someone to have a great, tremendous experience. That's what being a physician is truly about. And so for you guys as young people, recognize these economic pressures, and first and foremost, don't fall into economic pressures. Never be about the money, y'all. The money will sort itself out. Always put the patient first. Yes, was I getting pressure to that case? Yes, 100,000%. but you can't pressure me into doing something that's not in the best interest of my patient. Can't do it. And it's the same for insurance companies. This is how it goes, right? So I mentioned I do all these cases. This is how the billing works. As a physician, you have to pre-authorize what you do. Hey, listen, yeah, I want to do this surgery on you, or I want to do this anesthesia. Okay, we got to send it to the insurance company and make sure they pre-auth it. So I have to write down, I have to sit down, and I have to write down all the diagnosis codes, and I have to write a narrative. It's called a narrative note. I have to write a story that persuades the insurance company of why my patient needs this care. Then the insurance company writes back and says, hey, listen, you know what, we're not going to approve it or whatever. A lot of times they approve it. Oh, here, pre-authorization, we approve it. You're right. They need anesthesia. I'm like, great. So now they've already approved. They said, listen, they need anesthesia. Do the anesthesia. I do the anesthesia. You would think they would just pay me in advance, or they pay me when I did it, but they don't do that. I then have to send all the records, all the documents. I have to write further narrative. I have to tick all these boxes and document the codes, and then have a narrative that justifies why this code was applied, and blah, blah, blah. Do all this stuff. Then I have to fill out their specific forms and use their codes. I have to send all this to the insurance company. Not electronically, snail mail. The insurance company then reviews it, and they have 90 days to review it, and they get back to me and say, hey, listen, we're not really sure. Like, really, did you need to keep them asleep for that long? You said you used ketamine. Did you need to use ketamine? And then what do I have to do? I have to argue with them. Yes, I had to use ketamine. The patient was combative. The patient was blah, blah, blah. As I explained previously in my narrative, the patient was combative. The patient was blah, blah, blah. They needed this. I sent it back. Well, then why did induction take 30 minutes? It took 30 minutes because I couldn't just, ketamine works very quickly. Yes, but I couldn't just give them a full dose of ketamine because of this. Well, then how come you washed them? I had to wash them a little bit longer to make sure they were safe because they're on all the different, like, why do I have to argue with you if you've already pre-approved it? Why do I have to go and get at this? And someone said, doesn't Medicaid and Medicare, Medi-Cal, doesn't this stuff pay great? And the truth is, the sad truth, is that government insurance pays less than what private insurance pays. And this is why a lot of offices don't accept Medicaid and Medicare, because it's lower paying. That's why a lot of offices only accept private pay. They want the real, like, regular insurance, not the government insurance. And that's the truth.